Okay, so
I'm Dawn, I'm a registered mammographer.
And I'm Shelly Kurtz, I'm also a registered mammographer.
Ladies, thank you for coming today. Would you please tell us why it's important to have regular checkups for breast cancer? Dawn, we start with you.
Well, from what I've been doing, telling patients from year to year is we always compare the mammograms. If you have a previous mammogram from, let's say, last year, 08, and you come in this year in 09, that way we can visually look at from year to year to see if there's been any changes in the structure of the breast.
And Shelly.
And also with early detection, we'd like to do yearly mammograms on patients. The survival rate for women when a lesion is detected under 2 centimeters is 95 to 97%. Early detection, a lesion has to be localized under that 2 centimeter size. And also, along with mammography, you need to have monthly breast exam, which you will do yourself, a yearly exam from a physician, along with mammography.
Thank you. And
also on that note, I guess we should go over the ages. You know, by the time you're 35, you should have a baseline between 35 and 40, between 40 and 50 every year to every other year, and definitely every year after the age of 50.
Okay, and why is digital mammography a good way to have your exam?
First of all, digital is 50% less radiation to the breast than film screen. Also, with the image, we're able to take that image and manipulate it. We can magnify it up. We can look at it at different views, I suppose, without having to re-expose the patient. Also, patients say that it is more comfortable. And with digital, ductal carcinoma in situ is the most common breast cancer. With digital, it's been proven that we have doubled the detection of it over film screen mammography.
And the images from last year film to this year with the digital is just unbelievably clear, the quality. We're seeing more pec muscle too, and the reason why that's important is your breast tissue only extends from the nipple back to that chest wall muscle. So when we can visualize that chest wall muscle on that image, we know we're seeing all that breast tissue. So that's very important. But just the clarity, and like Shelly was saying, overall, the way you can manipulate that image within the monitor, the radiologist, he can take away structures from that breast, or he can add structures, magnify, zoom, like Shelly was talking about. It's just been very impressive.
Shelly, why are you a technologist?
I lost a sister to cancer. It was not breast cancer, but I know how that is to lose a family member. So when I go in, I know for mammography, I am looking for cancer. Women don't care if they have something benign going on in the breast. They want to know if they have a cancer. So I do not want anyone else to have to go through losing a sister, a mother, a grandmother. So when I go in, I'm treating that patient as they were one of my own.
I too have a similar story. A good friend of mine that lost her life to, it was leukemia. But this is a role that I can play to help women detect that cancer, and I guess it's one way that a role I can play in ensuring good health for my fellow sisters.